Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Eye infections. Introduction. Eye infections are common. They can be caused by bacteria, fungi, viruses, or parasites. They may affect different parts of the eye. One eye or both may become infected. Treatment for eye infections depends on the cause. Treatment may include compresses or eye drops. It may also include ointments or antibiotics. This program explains common eye infections. It covers the symptoms, diagnosis, and treatment. It also talks about how you can prevent eye infections. The eye. Our eyes are very sophisticated organs. They collect light and focus it on the back of the eye, allowing us to see. The cornea is the front, transparent part of the eye. It allows light to enter the eye. The rest of the eye is covered with an outer layer called the sclera. An extra layer called the conjunctiva covers the front part of the eye. Light hits the iris, which is the colored part of the eye. The opening in the middle of the iris is called the pupil. The iris controls the amount of light that enters the eye by changing the size of the pupil. As light passes through the pupil, it goes through a clear lens. Like the lens of a camera, the lens of the eye focuses light onto the back of the eye. After passing through the lens, light rays travel through a clear gel. This gel is called vitreous. The back of the eye is called the retina. The retina changes light signals into electric signals. These electric signals are sent through the optic nerve to the brain. The brain translates these signals into the images we see. Symptoms. Many eye infections have similar symptoms. The main symptom of eye infections is itching, irritation, or burning of the eyes. Eye infections often cause a pink or red color of the eye or eyelid. Other common symptoms of eye infections are crusting of eyelids or lashes, especially in the morning, discharge of pus from the eyes, feeling like something is in the eye or an urge to rub the eye, increased tearing, sensitivity to bright light. Some eye infections may also cause a red swollen bump, blurred or decreased vision, difficulty opening the eyelid tenderness, swollen or red eyelid, symptoms of a cold, flu, or other respiratory infection. Talk to your healthcare provider or an eye specialist if you notice any of these symptoms or other changes. It is important to find a problem early. This makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Conjunctivitis. Conjunctivitis is an inflammation of the thin, clear lining inside the eyelid and on the white of the eye. This lining is called the conjunctiva. Conjunctivitis affects children as well as adults. Conjunctivitis is often called pink eye. This is because the inflammation gives the eye a pink or reddish color. Pink eye is caused by viruses or bacteria. It can be caused by allergens like pet dander or dust mites. Irritants like smog or swimming pool chlorine can also cause pink eye, but only viruses and bacteria cause an eye infection. Healthcare providers often categorize pink eye by what causes it. It may be referred to as viral conjunctivitis, bacterial conjunctivitis. Treatment for conjunctivitis depends on the type and severity. Eye drops and cold packs may be used to relieve the dryness and swelling caused by most types of conjunctivitis. Antiviral medicine can be prescribed by a physician to treat serious forms of viral conjunctivitis. Antibiotics will not improve viral conjunctivitis because antibiotics are not effective against viruses. Bacterial conjunctivitis is often mild. It may last as few as 2 to 3 days or up to 2 to 3 weeks. It often improves in 2 to 5 days without treatment, but special antibiotics are often prescribed to treat the infection so that it does not spread to others. Stye. A stye is a red, swollen bump on the eyelid. It may look like a pimple and is often tender. A stye happens when bacteria from the skin get into the hair follicle of an eyelash. Glands in the eyelid that normally produce oil can also become blocked and cause a stye. A stye may form on the top or bottom eyelid. It is possible to have more than one stye at a time. Often a stye heals on its own within 5 to 7 days. The infection clears up when pus drains from the stye. To care for a stye, apply warm compresses to help it drain. This can be done up to 6 times a day for about 15 minutes each time. Never squeeze or try to pop the stye. If you do, it can cause a more serious infection. Scrub your eyelid gently with water and a clean washcloth. You can also use mild soap or baby shampoo. Close your eye while you scrub it so you do not injure your eye. Stop wearing your contact lenses if you have a stye. Using contact lenses when you have a stye can spread the infection to your cornea. Also, stop using makeup that may have become infected. Rarely, a very large stye may need to be drained by an eye specialist. If you are concerned about any of your symptoms, contact a healthcare provider. Keratitis. Keratitis is inflammation of the cornea. The cornea is the front, transparent part of the eye. Keratitis can be caused by a bacterial, viral, fungal, or parasitic infection. Some types of keratitis can cause decreased vision and even blindness. It is important to see an eye specialist if you have symptoms of keratitis to prevent further problems. Symptoms can include blurred vision, feeling that something is in your eye, sensitivity to light. The earlier keratitis is treated, the better the chances of preventing blindness and other serious problems. Treatment depends on the cause of the infection. If keratitis is caused by bacteria, antibacterial eye drops can often treat the infection. More severe infections may also be treated with oral antibiotics. Fungal keratitis is usually treated with both antifungal eye drops and oral antifungal medicine. Keratitis that is caused by a virus is treated with both antiviral eye drops and oral antiviral medicine. But these treatments are not always 100% effective. Viral keratitis may come back. Keratitis may also be caused by a parasite called acanthamoeba. This type of keratitis can be hard to treat. Antibiotic eye drops can sometimes help, but severe cases may require surgery to replace the cornea. This surgery is called a cornea transplant. Trachoma. Trachoma is a bacterial eye infection. It is caused by the bacterium Chlamydia trachomatis. This is the same bacteria that can also cause the STD chlamydia. Trachoma is more common in poor areas of developing countries. If it is not treated, trachoma often leads to blindness, eyelid abnormalities, ingrown eyelashes. Trachoma is very contagious and can spread easily. The bacteria spread through direct contact with discharge from the eyes, nose, or throat of infected people. This can happen when sharing clothing or towels. In developing countries, flies can also spread the bacteria that cause trachoma. The symptoms of trachoma are similar to symptoms of other eye infections. Often, young children become infected, but severe symptoms may not appear until later. Scarring of the inner eyelid or decreased vision may not appear until infected children become adults. If trachoma is caught early enough, antibiotics are often the only treatment needed to clear up the infection. Later stages of trachoma may require surgery to fix eyelid abnormalities caused by the infection. The eyelashes may also need to be removed to prevent further damage to the eyes. In some cases, a cornea transplant may be considered to improve vision, but often a cornea transplant does not work well in people with trachoma. Prevention. Most eye infections can spread easily from person to person. You can greatly reduce the spread of eye infections by following some simple steps for good hygiene. If you have an eye infection, you can help limit its spread to other people by washing your hands often with soap and warm water. If soap and water are not available, use an alcohol-based hand rub. Not touching or rubbing your eyes. Wash away any discharge from around the eyes, if present, several times a day. Hands should be washed first. Then, a clean washcloth, fresh cotton ball or tissue can be used to clean the eye area. Throw away cotton balls or tissues after using them. If a washcloth is used, it should be washed with hot water and detergent. Wash your hands with soap and warm water when done. Do not use the same eye drop dispenser that was used for infected eyes on non-infected eyes, even for the same person. You also should wash your hands after applying eye drops or ointment. Wash pillowcases, sheets, washcloths, and towels in hot water and detergent. Hands should be washed after handling these items. Avoid sharing items like towels, blankets, and pillowcases. Clean your eyeglasses. Be careful not to contaminate items like towels that might be shared by other people. Do not share makeup, makeup brushes, contact lenses in containers, or eyeglasses. Do not use swimming pools. If you have an eye infection, there are also steps you can take to avoid reinfection once the first infection goes away. For example, you should throw away and replace any eye or face makeup you used while infected. Replace contact lens solutions that you used while your eyes were infected. Also, throw away disposable contact lenses and cases. Clean extended wear lenses as directed. Clean your eyeglasses and eyeglass cases that were used while infected.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Eye infections are common and can be caused by bacteria, fungi, viruses, or parasites. Eye infections may affect different parts of the eye. One eye or both may become infected. Common eye infections are pink eye, a stye, keratitis, and trachoma. Treatment for eye infections depends on the cause. Treatment may include compresses, eye drops, ointments, or antibiotics. More severe eye infections may require surgery or a cornea transplant. Talk to your healthcare provider or an eye specialist if you notice any abnormal changes or eye symptoms. Finding a problem early makes treatment easier in most cases.
Thank you for using Explain.